Hello, everyone. I have a wonderful patient. She is 6 days out from her surgery. She had, to her surprise, implants above the muscle, and she thought they were below. So this was an interesting find. She had intact implants removed. She's only 33, and she had 325cc implants. Now, let me ask you this: 6 days out, how are you feeling?
I am feeling like night and day difference. The biggest thing is that the tinnitus, the constant ringing in my ears that I had before my surgery, which really was kind of like the final straw amongst all the other symptoms, is gone. The tinnitus is gone. I have more energy. I'm sleeping more soundly.
Now, describe what you mean by sleeping more sound, because I've heard this from so many ladies that they can have a nice, comfortable sleep. What does that mean?
So when I had my implants, I'm a stomach sleeper. And so I would, you change positions throughout the night. I slept on my stomach. When I'd roll over in bed, I would wake up when I had my implants with this burning sensation, primarily on my right side, which was more contracted, which Dr. Khan taught me. And so I would have this burning sensation. So that was waking me up. If I'd roll over in bed, it would wake me up. When I get up in the morning, that burning sensation, it was like a heaviness. I don't have that. I mean, other than just like the incisional pain or discomfort, I don't have that. I'm sleeping through the night, and I'm sleeping on my back. I'm sleeping on my back on a recliner, and naturally I wake up. I wake up at like 3:30 or 4:30 in the morning, and I feel rested. I don't feel like I'm being woken up by other ailments, other pain.
Yeah. Now, the most common symptom of breast implant illness is the fatigue. Someone would sleep 8, 10, 12 hours, and still they could sleep 4 hours. This is where when you wake up, you're fresh.
I feel fresh,
and
yes.
This is a major difference from before and after. Now, the other thing you told me, how was your pain level? How was your pain control?
Pain is very, very well tolerated. Something that I have a pretty high pain tolerance, but I was pretty nervous going into this operation, and nervous about timing pain medications, not being able to drive. I have 3 children that rely on me. The pain has been minimal, very, very minimal. I've been able to take extra strength Tylenol or Motrin, and that's usually, I kind of take it like prophylactically. If I've done something and I'm like, you know what, I probably did too much, like my help left for the day and my kids need a little bit more, I'll take some Motrin. I mean, it hasn't been anything more than a 3 at most. And I'll be honest, there's times too where I naturally go to reach for something and I'm like, oh, I have to do my T-Rex arms, but again, pain very, very mild, very tolerable. I'm quite surprised considering how invasive of an operation it is.
Yes, they're not very important, and this is what I would say easily 2/3 of my patients say. They took pain meds for 2 days. Some of them didn't need it even day 1 later.
Yep.
Some do, and it depends on how the recovery is post-op. Now, the next question is, how was your anesthesia?
Anesthesia was fantastic, and that was another thing too. Preparing and being in pre-op, I was very nervous. I hadn't eaten. I'd been fasting. I'm kind of a control freak, and Dr. Khan made it very apparent. Kirsten made it very apparent. Went back there. I was on the table. We were having a conversation, and I specifically remember telling the staff, "I think I'm going to take a nap now." Literally took. That's what they said. We're going to give you the best nap of your life. Didn't wake up. When I finally came to, again, the compression of the bra and the binder was very comforting. I know a lot of women, a couple days out complain of that chafing, which, yeah, that's normal, that's natural, because normally you don't have something that tight, but the anesthesia was fantastic. I didn't feel, I felt a little bit groggy, but no more groggy than when I had my implants put in.
That's very good. You're able to breathe. No general, but twilight anesthesia, which is safe, effective, comfortable for the patient, better recovery. Now, as you can see, you clearly did not need a lift, and you clearly did not need drains, and so for 325cc implants. Now, what would you say to the many others who listen to you and say this whole tinnitus and this whole being able to have a good night's rest, that this is all in your head? This is the good pain medication control or the good anesthesia you had. What would you say to them?
So the one thing when I had my consultation with Dr. Khan back in August that really resonated with me was that Dr. Khan said, don't listen to what I'm saying. You can go up the street and talk to another doctor. He can tell you something totally different. He can tell you BII is not real. He said, Dr. Khan told me, listen to the women listen to their testimonies, listen to these other patients that are getting their lives back. And that really resonated with me. And so that's where, if I can be part of this, empowering other women to listen to your body. You know, it's sometimes we are prideful and we don't want to go to a doctor and have all these different pain complaints and ailments, but truly you have to listen to your body, because me being 33, 34 years old and feeling like I was in my 60s, it was really disheartening, you know, trying to keep up with my 3 little ones. And I don't regret having my implants put in, but I wish I would have known about BII sooner. 12 years of having those implants, I probably could have had them out, you know, 2 years after having them, and I would have all these extra years with more energy and more time to be able to keep up with my little ones. So what I would say to you is, don't wait. Listen to your body. Even just come for the consultation. I'm telling you, a lot of your fears will be, you won't have those fears. You're going to feel there's such a group of empowering women that are here to tell you that these things are real. The tinnitus, I mean, it was debilitating. I work in the healthcare field, and there was times where I was like, you know, you start to think the worst. Like, what do I have? Do I have something going on in my brain? Do I have something going on in my inner ear? And I'm telling you, the tinnitus is gone. The ringing in my ears is gone. It was debilitating. I would be at work trying to work with patients or trying to fall asleep at night, and just this constant ringing in my ears, and I do not have that anymore. Mm-hmm. It was interesting because like day 1 or day 2 post-op, it wasn't a constant ringing. It was more like a Morse code. It would be like beep, beep, mm-hmm. beep, and it's completely gone. Mm-hmm. Completely gone day 3, and now we're day 6, and it sounds silly, but it is. It's one of those things that
right.
You know, it really irks you. How are you supposed to kind of work and go about your day and do things? And that's just, you know, one of the many things that have been alleviated. I'm just really looking forward to all the other things that are to come, and I'm very impressed with my results. A lot of women too, their fears. What am I going to look like after I have my implants out? And to me, it's no longer, you know, my breasts don't define me. They don't define my femininity. It's no longer really what I look like. It's how I feel. Mm-hmm. But it's just an added benefit, because I'm quite impressed. I'm quite impressed with how I look physically, and I can embrace my new body, my natural body. And I can also show my little girls that just embrace your body for what it is. Your health is more important than anything.
Do no harm. And now as you go on with the rest of your life, you have no worries. You have freedom from the implant, mentally and psychologically and physically, and in every regard. You're only benefiting yourself, and implants are bad. They're not worth it, and they're only replete with problems. And again, I say this to you and everyone else. Listen to all the other ladies who said their ringing, the tinnitus improved in the ear, and this is consistent with what is breast implant illness. Sounds bizarre, but that is real. And this is the silicone toxicity that is within the body, from all organ systems, from the hair follicles down to the plantar fasciitis and everything else in between, is negatively affected because of the direct result of both saline and silicone implants. Mm-hmm. So now, thanks for sharing your journey. We'll love to hear from you 6 weeks and 6 months out to see how you have improved and how you have gotten your life back and your energy, and only smiles.
Yep. Thank you.
You're welcome. Thank you.